We all want to secure an optimal healing environment for our patients' wounds. How can we get closer to this goal? In previous episodes, you've learned how to assess exudate and the gap. As you may already know, the gap is defined as the space between the wound bed and dressing. Now we will focus on how to manage the gap and wound exudate. In this episode, you will learn 1. Why do you need to prioritize the management of the gap and wound exudate? 2. How can a wound bed conforming dressing help you? 3. Why do you need to consider a dressing that absorbs exudate vertically and retains it? There is an agreement amongst healthcare professionals that managing the gap is one of the best methods to promote an optimal wound environment. Wound moisture balance and exudate management are critical for effective wound healing. Let's understand why. If the gap is not effectively managed, exudate pooling may occur. This happens when exudate collects in the space between the wound bed and dressing, referred to as the gap, and is not managed by the dressing. If the gap and exudate pooling is not managed properly, it creates an environment that promotes bacterial growth. Besides that, exudate can leak onto the wound edge and peri-wound skin, causing maceration and further delay wound healing. To start off, what is a wound bed conforming dressing? It's a dressing that closely follows the contours of the wound bed. There is a consensus amongst healthcare professionals that a wound bed conforming dressing is the best choice for wounds down to 2 centimeters deep. Did you know that 80% of wounds are less than 2 centimeters deep? Therefore, a wound bed conforming dressing can be widely used for different wounds in your clinical practice. Many healthcare professionals agree that the best way to manage the gap is to fill it with a dressing that conforms to the wound bed. Managing the gap with a wound bed conforming dressing reduces the risk of exudate pooling, maceration, and infection. Choosing an appropriate dressing can help you manage exudate, reduce the risk of exudate pooling, and provide confidence to patients. Wound care experts agreed that vertical absorption of exudate is one of the most important dressing features to promote wound healing. Vertical absorption in a dressing means that the fluid of exudate is absorbed into the dressing. The dressing retains the exudate even under compression. In this way, it does not spread laterally or go to the sides, leaking onto the wound edges or peri-wound skin. To wrap up, you need to manage the gap to avoid further complications. By managing the gap, you are also managing wound exudate. Choose a wound dressing that conforms to the wound bed, reduces the risk of exudate pooling by filling the gap between the wound bed and dressing, absorbs exudate vertically and retains it in the dressing.